Yep,
Even
let's
better.
go ahead.
Good timing. So thank you, everybody. I know we still have a bunch joining, but we want to open the meeting with some remarks to the community from Dr. Hushman. His time is limited as he has other meetings he needs to join today. So I thought I'd open the meeting, turning it over to Dr. Hushman to talk about the kickoff of the semester and where we're going.
Thank you, Tony, and thank you, Bill, for doing this again. I think the more of these events, the better. And I also want to thank everybody for joining us for this very important discussion. I wanted to talk about last week's event, weather event, the tornado, and say that, look, when I look at this thing, I would say the hindsight is 2020. I wish we have done things differently. I want to say that I would have preferred that we had acted earlier. It was our mistake. It was my mistake. Ultimately, I'm the person in charge, so I take full responsibility. And I would make the following commitment that I've asked already the Senate President as well as the Provost. They need to put a solid team together across this campus that annually look at every event that requires us to make action so that we can make it timely and appropriately for the safety and well-being of everybody. That I commit to everybody, and they have already started. And that, not only that, but I have already always, and in my meeting with the Senate leadership, I always emphasize, as far as I'm concerned, the tent where the people of Rowan University can gather and solve the issues of this university is large and wide open. Everybody is welcome to come in. Nobody is excluded. We will talk to people. We will listen to their opinion. We act accordingly, and we act scientifically. And we really, quite honestly, in the process, do not get intimidated by emails that are hurtful, words that are inappropriate, calling a vice president stupid or calling this and that. We don't do that kind of thing. But I commit to you, and you can try us. And the President of Senate and I have been in conversation for several years in that regard. Come join us, provide your input, provide your solution. We will do everything we can to include you into the decision-making of this university. This is an open university. It's the most amazing university, in my opinion. This is the only university in the state of New Jersey where everybody else tried to use the federal money, bank it in their account. We gave it back to students. We gave 10% discount. That cost us $20 million. We are the only university in the state of New Jersey that did not furlough any of this faculty. We are the only university in the state of New Jersey that is giving up to $1,000 money for people to get vaccinated. As a result, our vaccination rate is better than even Stockton, who started imposing restriction that everybody be vaccinated. Therefore, in my opinion, the team that is looking at the issues that are concerning us and concerning all of you, we are doing our very best. Along the way, on occasions, we make mistakes. But every single person that I know of, that includes most of the overwhelming member of our faculty and staff and administration, they care for this university. They wake up every day. They want to do their best. They want to be safe. They want their family to be safe. I respect that. I accept that. And I said that last time. As far as I'm concerned, nobody is wrong in here. This is a difficult time. People have different opinions. There are emails that have come to us that has hurt us to the core. But we don't react. We don't get angry. We move on because we believe that we have a much bigger responsibility to run this great university in a way that can stay in power and can be a strong university for generations to come. So I urge us to have a great conversation again about the wellness and about our effort regarding the pandemic, and provide your input constructively. We will take it into consideration, and I commit to you, if your idea is better than anybody else's, we will implement your idea. With that, I want to thank you again, Bill and Tony, for doing that, and the more the better. Thank you.
Thank you, Dr. Hushman. I know you have other things, so if you have to drop off, please feel free. So thanks everyone for joining us. As you know, we promised to get back to you and do these things regularly. We think it's important to keep you updated. We think it's important to hear your feedback. We think it's important to answer your questions. So I want to echo what Dr. Hushman said about last week's tornado. Number one is I know probably on this call today. I know on the panel today, we have people whose homes and lives were touched by this tornado. And I feel for each and every one of you, but hindsight is 2020. We were dealing with, quite honestly, a dated policy for emergency management at the time. And we acted what we had. I could tell you that the next day we were engaged with Bill, engaged with emergency management. How can we come up with a reasonable policy that meets today's times? So I think, within the next week, you can expect to see a policy coming from us on that I think is more in line with where we are today as an institution and how we can deliver our services and businesses. So stay tuned. You definitely have input on this, and your faculty team working with us is great. I also want to talk about I know another rough spot last week was the rollout of the vaccination lists, and it was a chaotic time. I know that for many of you coming back into the classroom, this is a challenging time. You've done tremendous work helping lift this university for the last 18 months. You've gone from face-to-face to online to hybrid to online, and now we're asking you to come back to face-to-face. And during this last 18 months and during this first week of classes, I've seen and heard nothing but outstanding work is being done in the classroom. So I applaud you for that. And for the issues we had last week with the confusions on the lists, I thank you for your patience, and I really want to apologize for any anxiety this caused you. We're going to continue to make this better. We're continuing to work to automate the system, but I just want to give a shout out to the amazing work that Kevin and Scott Woodside did. And from some of your comments, particularly the comments in our last discussion, the Wellness Center took it upon themselves to go in and manually verify almost between 15 and 16,000 vaccination cards submitted. So rather than take these cards and just put them into the system and say they're done, these teams went in and verified each and every one to ensure that we did not have fraudulent cards. So I applaud them for their efforts, but it led to some confusion and anxiety in the first week, and I truly thank you for your patience. I thank you for your understanding, and again, I offer my apology for any added stress it put on you at a time that was tough. Moving forward, I feel good where we are. I've heard, again, nothing but wonderful things from our students coming to the classes, seeing their faces on campus happy. I personally have a junior who couldn't be happier to be back on class and back in the dorm and taking classes from some of you. So I'm hearing great things. So moving forward, an update I want to give is we've established a working group we've asked Bill to put together a team of faculty. We have a group of 4 faculty and staff members now that we've begun our weekly meetings. This group will meet every Monday following our emergency operations team. And during that meeting, we're going to address concerns, issues, answer questions, provide full updates of all of the data we have, and give a snapshot into the directions on where we're heading and seek input. And just to give you a little bit, one of the things you're going to hear about today is out of our conversation and on, I guess it was Tuesday because the holiday week, Bill provided from the group a recommendation that they would like to see more asymptomatic testing on campus, not just limited to unvaccinated. So we're going to move forward beginning next week to provide for testing for anybody asymptomatic on our campus who would like to get testing. This will be done every Wednesday and Thursday. It'll be done out of the Owl's Nest, and details on how you can register and sign up to be tested will become available no later than Monday, I hope. It's just a matter of getting our data system set, and we hope to have rollout by Wednesday. So Scott's team stands by, ready to go, and we look forward to doing it. I can tell you this, I went over and I was the test case today. I brought my phone with me. It took me less than 5 minutes to register, get the Q code, go through, swab my nose, and get tested. So 5 minutes, it works, and we'll be rolling that out all next week. So I look forward to adding to that. So other than that, I think the more important updates are going to come from the rest of the team. I wish everybody the best and continued success, and we're here to answer the questions, and we look forward to the dialogue today. So Bill, would you like to say anything before we kick it off to the rest of our team?
No, I'd like to thank everyone for their patience. We knew this was going to be a bumpy start to the semester. It was bumpier than many of us had anticipated. It seems to me that so far the second week is going smoother. Just to return to what both the provost and the president said about emergency management, we've got great people on this campus who can do that. I mean, DeMonda Miller, who is the Senate Vice President, set up the Disaster Preparedness and Emergency Management Program. We're going to get people from communication. So that's a problem that we definitely can fix. So looking forward to that.
All right, so I think we're going to move into first is Scott Woodside will be up. He'll talk about our testing program, give you some updates on our results of testing for the first week and where we're headed.
Thank you, Provost, and thank you, Bill, as well for hosting the event and narrating. And really, I'm happy to answer whatever questions come our way. I'm just going to give you a real brief snapshot of where we are. And perhaps I think if we should probably pull up the Return to Rowan site in a few minutes so that we can look at that and make sure you're all comfortable with how to find some of the information that I'm going to review. And before I kick it off, I can't thank my team enough in the Wellness Center. I'm in the trenches with them, and it's definitely been a very, very rough first few weeks, and I couldn't really do this without Kevin Kett as well, our Dean of Students. I don't know how he does it actually. He's working day and night for sure, as many of us are right now, and many of you that are listening. You know, and even though you're not in the thick of it like we are, I know you're managing what's going on, and you're answering questions, and you're talking to students. So thank you. We really do appreciate it. And as some of the comments already came across of some of the negativity that we are receiving, you know, some of that's constructive and we're taking, but you know, some of that is difficult to hear. So know that we are really trying hard to you know, continue to improve. But we appreciate your patience with a lot of that. So I can tell you right now, things are going well. Our systems are functioning. I mean, we are doing our best to see students and test students. We know that many students don't come to us for testing, and that's okay. We know that we fill up with appointments just like any healthcare system does. So those are happening. We're trying to process students as quickly as we can. As Provost Lohman had mentioned, we are going to be expanding some testing opportunities. We're hoping that relieves some of the stress and pressure that we're seeing. We are certainly seeing cases. I mean, that is happening, and that is expected to happen. I'm currently tracking 38 active cases in students and 7 active cases in employees. But that's a fluid number. That's going up and down because that's a 10-day window that we're looking at. So we're getting reports every day. Our contact tracers are in real time caught up. So that's working well. Our surveillance testing is working well. We did last week 1,062 tests, I believe, and they all came back negative. We did 66 tests yesterday, and I'm not sure how many we'll end up with today. And we did have some positives from yesterday that we're doing contact tracing on now and checking into that. So that will continue, and that's again another reason to expand testing. I can also tell you that one of the reasons, other than the good input and feedback we're getting from Bill and his team and from our leadership as well, is that we are seeing positive cases in vaccinated as well. So that's one of the reasons why we're expanding and making that available. I'm going to share my screen real quick just to show you the real-time data that is available to you all on the Return to Rowan website. I'll be very brief, I promise, with that. So this data that you're seeing is in the Return to Rowan site. If you click on Confirm Cases, you can scroll down to see how many students we have in isolation. The cases going back to January, actually, so you can see trends. And similar to last semester where we had an increase in cases in the beginning of the semester, we are seeing that as well. So looking here at the cases, and these are actual cases by test date. So as we get them, and as you can imagine, some reports come to us a day or two later, sometimes 3 or 4 days later. They get entered, and these are corrected. So these numbers will change historically as well. What's easy to look at is the epi curve, which shows us really for the past almost 9 months now what the case counts look like. As you can see, we did see a significant increase last semester as well. And we're seeing that again and tracking that. We're also tracking a number of things in addition to these cases. We're tracking hospital data, and as you can imagine, hospitals are also seeing an uptick in the number of cases. So we're in communication with them in terms of ventilators that are available, just so we have that knowledge. We're tracking the state site, and we're adding all that to the body of knowledge that we have to help us make decisions. Everything that we do in terms of contact tracing and follow-up has been cleared through the health department. So I actually send them a list of all of our contact tracing information daily. We also send a list of all the tests we do to the state daily. So all that communication is in real time, and is something that we knew we had to do as a part of this. Triad is, again, working well for us, and again, I'm super grateful to our teams that help over there and making students feel comfortable. Not every student likes being in Triad, which is true, but it is an amazing space and opportunity for us to keep students here on campus safe, for sure. Part of the contact tracing, we're asking all the questions that we need to ask and collecting. I know one of the questions that came up was, what are we tracking longitudinally? We're not tracking longitudinal data. I can tell you the thousands of people that I've talked to, there are some terrible stories. I mean, we've heard stories of students that lost parents, and our own Rowan family that have lost family members. And so we are, of course, aware of all those things, but we are tracking really the immediate issue, which is students who are positive and trying to stem any type of connections that they had, and quickly quarantining and isolating where appropriate. So all things are happening, and I'm grateful again to our faculty for our communications we have with them and sending information back to us. Please, if anyone asks where to submit information, if you go to the Wellness Center homepage, there's a link for employees and a link for students. That's one way they can do it. They can also call us at the Wellness Center. And we're responding as quickly as we possibly can. And I hope any faculty that are listening know that we're doing our best to respond quickly. And for some reason you didn't hear back from me, just try again. There's a lot of data coming our way. So we're doing our best to track in real time. And I know there's some other questions that I can get to, but I don't want to occupy all the time. So I just to echo what Dr. Lohman said, we're doing our best to be flexible, reasonable, and responsive, which is why we're having a lot of these feedback loops and hearing some constructive criticism, which is great. And that's what we need to keep moving forward. Also, vaccines are going to be back on campus. We were here all last weekend for move-in weekend, and then we're back again on Monday. So for anyone interested in getting vaccinated, the Owl's Nest from 10 to 2 every Monday going forward. Flu will also be available there once the county has that available to them. So great opportunity to get vaccinated on campus. The mega site will be open shortly towards the end of September, right down the road in Clayton. So lots of opportunity to get vaccinated for those that are interested. Boosters will be also available there. So a lot of opportunities that, and I can't, again, think of one university that offered as much vaccine as we've offered really from the beginning here. So that's one of the ways that we're making sure we're keeping the campus safe. But there's nothing that's absolute. There's no test, there's no contact tracing, there's no medication. Nothing is going to be the one thing. So it's all these things combined. So we'll get to some of the questions and answers, but I want to hand it back over to you guys to move on the presentation. Thank you.
Actually, Scott, can I ask a quick question that came up in the Q&A? If you look at the total confirmed cases at Rowan, the number on the right does not seem to be the sum of the other numbers in that row. Is there a reason for that?
The number on the right doesn't seem to be the sum.
So the total, if you look, the far right number should be the total. And I'm looking at 9/5 through 9/11. It says 14 total cases, but there are 16 cases on main campus and then another 4 scattered throughout. So that obviously is not 14.
It appears to be, it's looks like the other lines look correct. It appears to be an error on that one.
Yeah, that's probably
I might say it was an engineer did the math maybe.
Or it's taken from a spreadsheet that gets uploaded, so there might be a glitch in that formula. I'll recheck that, and I'll have the team that's helped me with that recheck that as well.
Okay, great, thank you.
Yeah.
Tony, are you doing the introduction?
Oh, yes, I forgot that I'm running the show. It's not Joanne. So I believe, I'm sorry, I have to get my
run a show up here. All right, I believe our next presenter is going to be Kevin, I think.
Good afternoon. Thanks for being here. I appreciate everybody's time and certainly want to echo the appreciation for Scott and his team. They're absolutely working themselves into a hole, and I really appreciate what they've done and the yeoman's task that they've accomplished. So thank you, Scott, to your team, and thanks to everybody. It took a lot of us to get prepared for the fall, and I just appreciate everybody's work. A couple of things for us. One, I do want to echo, I appreciate everybody's patience and I appreciate everybody's feedback. I can promise you I have been the source of anxiety and stress and frustration and anger. I apologize for that. That certainly is not intentional, but I own every bit of that, and I'm sorry that happened, but we are working on making improvements. We're working on some automations, so I hope that you can accept my apologies for any stress that I added, but hopefully we're now in the mode of just moving forward. So thanks for all the feedback that I've received, and thanks for the comments. I certainly appreciate those. We continue to notify faculty. Right now, we're at 96% compliant. We are at 91% vaccinated and 9% declinations. We have 15,971 students that are compliant with our process. We've got 5,407 students living with us in housing. Right now, we've got 7 students that are in triad, and we have seen 2 reports of students who are not compliant in classes with masks or other issues that we have addressed. So I appreciate the faculty who have brought those concerns forward. We'll continue to send notices to faculty as students become compliant. We also are sending notices to faculty for anybody who has to be out for a period of time. Those letters are being sent via email. So we certainly, again, know that the process is not perfect, but we're trying to enhance it and making it the best we can. So I don't know, I'll certainly happily answer any questions, but I want to focus more on questions than that report. But those are the things that I think are primary for my areas.
Tony, I think you're on
Yep.
mute.
Oh, sorry. I keep forgetting the wrong. Oh, I'm living like everyone. A couple things. Could you touch on, I think, the joy of WebEx? Can you hear me?
You hear me?
Can anybody? I'm not banned.
We're having trouble hearing you, Tony and Bill.
Anyone here can help?
Tony, you broke up, Tony.
Believe this. Annette,
Yes.
you're up.
Oh,
frozen.
okay. Good afternoon, everyone. Thank you, Tony and Bill, for inviting me to participate on this panel. I think that, the constant communication is key to keeping
Tony, you're coming through broken also.
Oh, I'm using my handheld because my laptop is failing me. So I will try my best with this. So some of the information that I will share with you is gleaned from multiple sources. Many of you who know me know that I've spent 40 years practicing medicine, of which about 35 has been dedicated to the subspecialty of infectious diseases and epidemiology. So I have a great and abiding interest in this area. And I've served on the professional advisory committee for the Commissioner of Health of New Jersey, the Council of Deans, so we get a lot of national information there, and also the Infectious Diseases Society of America. Some of the sources provide information that is just being gleaned from studies that are being done, research studies, etc. So I always like to try to give a context to the information I provide. Now, everyone knows we're in the midst of another surge. I think Scott said it well, that there's a combination of efforts in any type of public health emergency like this. Vaccines are the most important piece to getting us out of this, quite frankly. Masks, testing, hand hygiene, distancing, all of these factors come together to make for a safer environment. Okay, safer environment. I don't say totally safe environment, but a much safer environment that allows us to resume some semblance of normal function within the context of the pandemic. Now, I do believe the pandemic will end. Nobody has a crystal ball to when this will happen. The World Health Organization will declare it over eventually. But until that time, I think we have to try to achieve some semblance of balance with regard to our jobs, our educational system, et cetera. And I think this is what we are achieving as Rowan University, as the two medical schools are certainly doing that. I'll tell you a bit about that soon. So the key to this is the vaccines. Now, with regard, the state of New Jersey has actually done very well with their vaccine program. Over 6 million people have received at least one dose. 5.5 million and change are fully vaccinated. The fully vaccinated rate is 62% of the population. At least one dose, 70.7% or so of the population. The US data for fully vaccinated is 54%, one dose, about 63%. New Jersey has been sitting in the top 10 states nationally. In South Jersey, the numbers are variable. There's some communities that have low vaccination rates. I know that our sister school, SOM, and I don't know if anybody is on this from SOM, has done a Herculean job of rolling out vaccines. And many of you may have been the recipient of your vaccines in that venue. Similarly, our CMSRU students, have been involved in delivering 100,000 doses to the citizens predominantly of Camden County, especially Camden City. So they've donated 8,000 volunteer hours across the board in this initiative. We've returned, our student body at CMSRU is 100% vaccinated. We have also resumed our masking for the relatively small numbers of employees who are not fully vaccinated for whatever reason, either religious purposes or a situation where they can't receive one of the vaccines. This array of activities spells a safer environment for all of us. The vaccines are safe and effective. With regard to prevention for the Delta variant of very serious outcomes, such as need for hospitalization and death. The vast majority of people who are being hospitalized now are those with COVID who have not been vaccinated. There are some cases of breakthroughs, but those are generally milder illness. Now, of course, everyone has an anecdote about somebody that they know who is fully vaccinated. There may be some questions coming up about boosters. So the boosters are the planned rollout for the boosters has already happened with regard to those who are immunocompromised. That is the first group that's going forward. And there's a broad range of individuals with immunocompromising conditions. People who have had transplants, people who have malignancies, people who are undergoing chemotherapy, people who have rheumatologic conditions that are on biological products that affect their immune system, et cetera. So the range is very broad of those individuals. The FDA and the ACIP are looking at the data, and they've asked for a bit, and the CDC has also asked for a bit of a pull-up on some of the plans that were released by the Biden administration with regard to boosters. But the rollout for those will eventually happen. It's likely that this is going to be for those who have gotten Moderna or Pfizer a 3-dose vaccine instead of 2. It is not unusual to need boosters. Okay, so it is not unusual. So the rollout of that should be happening sometime this month, but additional data is actively being reviewed by the FDA and the ACIP, which is the group that has controlled immunization products for decades. So, the plans will be released for where to get the vaccine. Many offices will have these vaccines. Major physicians' offices will be able to administer them for you. So I am going to stop at this point and turn it back to Bill and Tony.
So thanks, Annette. Bill, sorry, I want to steer one question back to Kevin because I had my WebEx, the mandatory WebEx issue as it came up. Kevin, I was going to ask, one of the points to add on is about automating the compliance status in Banner and in our timeline and target for that.
Yeah, and I apologize, I got kicked off as well. So, but we are, based upon great feedback that we've gotten, we've got a team that's going to meet on September 16th to look at how can we improve the process, how can we enhance it. And so we will hopefully have a much more robust, much better plan of action for the future, but we're going to look at that on the 16th based upon the feedback we've received.
Thanks. And I'm gonna turn it over to Bill to kind of moderate the Q&A. I think there's a lot of questions on here. Some of them are being answered, but there are going to be some specific questions that are maybe individualized. And for those of you who have asked those questions, we'll make sure to get back to you individually. But I think Bill's going to focus on some of the bigger picture questions that are more important to the community. But if you asked a question here, we will definitely get back to you on it.
And I just want to follow up with what Kevin said about Banner. A lot of people are asking, why didn't we just put compliance, non-compliance in Banner? The answer is almost anything is possible in Banner and nothing's easy. As someone who's had to work with what seem to be relatively simple changes, I know what a nightmare they can be. So there's a good reason that hasn't been rolled out yet.
And we're certainly moving to get it there.
Question. Yep. Okay. Keeping in mind that many of the positives that we see are tested off campus, what is our positivity rate with testing on campus? Numbers, rate, all of that.
That's a good question. I'm sorry. I'm assuming that just went to me.
Go ahead.
That's a good question. I don't actually have an answer to that, and that's because we've been focusing on getting all these systems up and running. I can tell you we haven't had many tests that we've done on campus that have been positive until this week. So this week we did have a few. I don't believe there was any today. Yesterday, I believe we had 2, and the day before, I think we had 4. I don't know what the exact rate is, but we're doing roughly 40, 50 tests a day. That doesn't include the rapid test that we did on move-in and all the testing we've done in the past that were negative, which has been great. But yeah, so we are seeing that increase, just like we're seeing in the rest of this region, an increase in transmission. So we're following suit with that. I'm going to be working, Bill, over the next week or so to tighten some of that up, so I have that, and you'll see that when we do our reporting, and we'll whatever we can make available, we'll make available. But yeah, I don't have an exact rate, unfortunately, but I can tell you the numbers are increasing, just like we're seeing in the region.
Okay, thanks. And are we keeping track of?
Bill, real quick, to answer that question, we will be moving to get that up. We had the data up in the spring, and we haven't compiled it all yet, but our test data will be up as soon as Scott has the break to get it up. We'll put it up on the website along with all of our positive test data, just like we did in the spring.
Okay, sounds good. Are we keeping track of the severity of the cases, specifically with hospitalizations and, God forbid, deaths?
Yeah, so as I mentioned before, we were not tracking longitudinal data, so we're not doing that level of study with it. I can tell you that there were some students, even going back to the beginning of this process, that were in the hospital, usually with a co-infection. They had pneumonia in addition. They had some other condition. We are very our bar is low to send someone to the hospital if we suspect. That's what we do. So if there's an individual who has difficulty breathing, we send them. By and large, students that are in that situation are discharged, but there are some students that did have a day or two in the hospital and got released. I'm not aware of any student deaths related to COVID, not that I'm aware of. But of course, I don't have all of that information. Sometimes things don't get reported. Similarly with employees and employees' families, we don't always get that information. But so I'm not tracking that actively, but I can tell you the overwhelming majority, especially in our student population, has been very mild symptoms, especially in the vaccinated population. But there of course have been students that were in the hospital over the span of this pandemic. So nothing is absolute. I would never say that students never get sick enough to go to the hospital. That certainly does happen.
Okay, thanks. And if we have a classroom situation where a student tests positive, wouldn't it be the case, if it's, you know, a normal classroom at capacity, that many of the other students surrounding that student would fit the CDC definition of a close contact, 6 feet or under for 15 minutes or longer?
Yeah, so I specifically had meetings with the health department prior to the start of the semester to find out what they were going to use for contact tracing. So their contact tracing protocols are in a forward-facing straight classroom. Only individuals that had face-to-face interactions with fellow students or professors will be considered a close contact. So what I've been doing is notifying professors of anyone that was in that window period of infection. And saying, hey, we identified a student. They didn't report any of that type of interaction that I just described. Everyone was wearing masks. If that's not the case, let me know. And some have gotten back and said, actually, we put students in a group. And if that's the case, we try to find out if we can figure out who that is. And if we can't find that out, we would notify the class that, you know, there has been a positive case. This is the guidance for vaccinated. This is the guidance for unvaccinated. So that's the process that we're working under. I certainly have gotten feedback saying I think everyone should be a close contact, and that's certainly not what the health department is following, that their guidance given to me. So we're going by that. And you know, that could change. I mean, the guidance changes all the time, just like it could change about testing and again, mask wearing. So we're constantly following that. I can tell you, I send a report. I don't know if I said this, and if I'm repeating myself, Bill, just yell at me. I send these reports every day to the health department. They call me every day, so that interaction is constant. So this is not a Rowan. This is we're following the state protocol.
Bill, I'd like to chime in as well. You know, some of these protocols do change over time as we learn more and more. But if someone is concerned, there is ample testing available through a variety of venues, you know, free testing. So if somebody is sufficiently concerned about a contact, they could go forward and get tested. Nothing prevents them from going forward and getting tested.
Thank you, Annette, because that was actually one of the other questions that was going to come up. What's the best way to do that, both for, and this is probably two different questions, students and then faculty, employees, staffs? So if a student suspects they may have had a close contact, where should they be tested?
Scott, we can't
Scott, you're on mute.
hear you, Scott.
Thank you, Annette. You would think I would know. So yeah, students who have symptoms or contacts should notify the Wellness Center, and we'll schedule testing. We do most of our testing at Holly Bush for contacts and symptoms. Sometimes we are talking to students, and if they are in a single room, and we can't do any more tests that day, we guide them on that. Some students we do refer to triad if we suspect they're a contact and they have symptoms. And then we test them, you know, over the subsequent stay while they're in triad. So there's no hard and fast on that, but that's the recommendation, is to contact the Wellness Center. Now, again, I know for a fact some students don't want to come to the Wellness Center. If they do get tested off campus, please advise them to notify us of the results of their tests so that we can do what we're talking about and have all this transparent data and do contact tracing. So that does happen. In terms of employees, you know, testing does vary. So when I notify employees, I do put the link for the New Jersey testing sites that are in the area. As Annette mentioned, some are free, some are restricting who they're testing, meaning some are only testing those that have symptoms or exposures, which again is one of the reasons why we're going to be expanding the asymptomatic testing on campus. So again, we're looking at all that, trying to be flexible and adjusting as we go, but testing is widely available in general. There are times when there are peaks, just like with any healthcare system. Sometimes things fill up. In that case, if you suspect that you have been exposed or should quarantine, then you need to follow the guidance of your provider or the guidance that's issued by a contact tracer or by us. So we want people to make good judgments, and especially if you're sick, the expectation is you shouldn't be around other people. So there's not usually a clear-cut answer. There's a lot of times some gray in there, Bill, and we'll try. And I can tell you, I've guided a lot of our Rowan family over the past year, and I'm happy to do that. So they can certainly reach out to me, and I'll do my best to give them good info. But that's kind of the long-winded answer. I apologize.
That's a good one. Sort of a follow-up to that. Are faculty in any way responsible for notifying the class if someone has tested positive? This is a question that keeps coming up.
Yeah, so no, but I know that some faculty or chairs or deans you want to do that, and I usually guide them on that if they want to talk about language, because we do have to protect confidentiality, which is the only time I do work with a professor on that is if they say, hey, yes, these students were clustered and I don't know who they were, and then I have to work with them, but I stress the confidentiality in that case. But if they do want to notify that class, listen, they're just like we do with most other things. When a faculty is in a classroom, that is their classroom. So I can't tell them not to do that. And just like I would never tell someone not to get tested. So if they choose to do that, they certainly can. I'm happy to help them with some language to help them through that. But just know that part of our contact tracing process is we notify those people that the student or the whoever, the employee, tells us, hey, they had a 15-minute conversation with this person. They went to lunch with this person. And so we make those notifications there. But I know there's some different understandings of what that could be and comfort levels. So I'm happy to work with them in that individual case.
Good, thank you. We spent a lot of time talking about classrooms, but one of the other major concerns is offices. So specifically, how can we enforce social distancing in a small office? One of the things I keep thinking of is counselors and advisors. Small offices, often personal conversations with students, vaccine status is unknown. How can we enforce social distancing either with students who are there or perhaps with other coworkers?
Yeah, I mean, that's a good question. So a lot of the information on recommendations how to do that are in Return to Rowan. But like I said before, there's certainly a lot of gray. I think managers of certain areas, I think, should be working with their teams and identifying spaces. If they need to meet one-on-one with an individual, make sure that there's adequate 6-foot distance between them. And if they have to use a larger space, maybe accommodate for that. I know we have some models where we do a little bit of virtual, maybe as an initial visit if we're talking to an advisor or counselor. So each individual team should be looking at that and making recommendations based on what HR has put out in terms of guidance and what they're reading from Return to Rowan. Knowing that there is no exact answer. And if someone is in a space and 2 days later, that individual, one of those individuals, whether it's the employee or a student, we're positive, we'll do the contact tracing process. So there is no perfect solution there, but I think the managers and the staff should look at their spaces and do the best they can. As Annette had mentioned, physical distancing, is one of those ways that we can address that in a one-on-one face conversation, which we're trying to minimize, but still allow for. So we're in this transition period that's difficult, and none of this is a perfect solution for sure. But I think having a good strategy and plan individually based upon your department and the needs of the students is important.
Great, thanks. I'm sorry, I didn't know if someone was getting in there. Okay, a question for Joe Campbell, Vice President of Facilities. We've had a lot happening since spring 2020. We know that ventilation in rooms and buildings is crucial. What are the number of air changes per hour in our various offices, classrooms, labs? Do we meet the recommended standards? And how many can we assume are actually taking place in all of those areas? I know that's a big question. I apologize for the scope of it.
So thank you, Bill, for the question. And first of all, I just want to say that all of our systems in our building ventilation systems were designed for maximum occupancy and extreme environmental conditions based on the ASHRAE standards. Right. So when I say extreme, the hottest temperatures and the lowest temperatures, maximum occupancy. So that's what the ventilation systems are designed for. Filters with the increased MERV 13 rating were installed to capture more contaminants and replaced according to safety and health protocols and industry best practices. And they'll be replaced more often if needed. So your question is about ventilation. It's about trapping and flushing. That's really kind of what you're asking about. So we're kind of hitting it on both those levels. Also, all of our air handler units have been modified to allow maximum outside air as outside conditions permit. So we actually went into all the buildings with our controls people. They looked at the set points, and then they maximized outside air for that set point. The third thing I want to say is that buildings with that are labs have 100% outside air at all times. And your question about exchange rates, and I know that people look at the JAMA article, and we look at the ASHRAE standards. And so we're looking at the exchange rates, but I think what you have to also understand is that those exchange rates, we can go in at any time, but the exchange rates are, I think people are looking for 4 to 6 as the exchange rate, and we work to meet that, and that's kind of what the systems are designed to do.
Great, thanks. Now, obviously, a lot of faculty and staff work in Nexus-owned buildings on Victoria or in the Enterprise Center. Did the Nexus buildings also meet those standards? I'm not sure if you know that.
Yeah, so actually I do know that, Bill. So what we did do was there was a question about that, and I think the question was actually more on the side instead of the air exchange rates, they were asking more on the MERV filters. And I do know that all those locations have the MERV 13 installed, and I do know that the buildings were commissioned with the same standards.
Okay. Great, thank you.
Bill,
Question.
there's a question about flu, I think, about flu vaccine, influenza vaccine. May I take that just to address that?
Absolutely.
Because I think that's an important consideration. Last year, we had minimal flu activity pretty much in each hemisphere. And I think all of the measures, the masking, the hand hygiene, the distancing, and people getting their flu vaccine helped with that. So please do get your flu vaccine this year and continue these measures with hand hygiene, your masking, etc. When you get your booster, you can get your flu vaccine at the same time. So that's another important consideration. There's no contraindication to getting them at the same time. So it may be, though, that the boosters are released a little bit later. So as soon as you can, please do get your flu vaccine. And if you happen to go in and you don't have your flu vaccine and they're giving the booster, it's safe to get your flu vaccine at the same time when you get your COVID booster.
Thank you, Annette. Question for Terry Dry, Vice President of HR. I assume this is for Terry. Does the university have a policy that is going to handle how we report to work or our time if we're required to isolate or quarantine? And a follow-up to that is, if the job can be performed remotely, will we be permitted to work remotely if we're not, so symptomatic that we're incapable? And who will make that determination? So I guess it's kind of a 3-part question.
Okay. So yes, we will have a process. The Wellness Center immediately notifies us when we have that situation. If the exposure occurred here, then there's a separate process because we wouldn't charge an employee for time at that point. If the exposure occurs outside, then they would be utilizing time or, whatever the state determines we should be doing. We always want to be able to be flexible with remote work. I think one of the questions that came in prior was if someone has a one-day emergency, can they work remotely without going through the flex schedule? And if they read the policy, yes, that is permitted, even if the person isn't eligible for remote work generally. So we will continue to be, as I kept saying last year, we will be as flexible as we can while we provide the needed services for our student education and student safety. Whether someone's able to work remotely really becomes a joint decision between the person supervisor and human resources. HR is looking at it from the perspective of, are they exempt or non-exempt? Does the job description fit? Are they under a performance improvement plan? A lot of those types of areas where the supervisor needs to know whether they're able to manage the office or the department with the person working remotely.
Great, thank you. I'm not sure whose question this should be, but if a coworker tests positive, and by coworker I mean someone working in the same physical space, will other people in that office or physical space be notified?
Some of that, I'll take part of this answer. Probably some of it depends on the contact investigation. So we have a number of employees that are either working remotely or in and out. So a lot of times, Bill, it's the case that an employee hasn't been to campus for a number of days, and they're not in that infectious period. Now, any employee that is confirmed positive in the infectious window, obviously, as Terry said, all get reported to HR, and then HR has a protocol of announcing that, and our cleaning protocols are in place at that point. So I would say that, and then it would depend on contact tracing. If they identify who they were in office with, and then it goes to me and my contact tracing team to notify. So I would say that's how that would work, unless Terry wanted to add something, but that's how that works from a contact tracing perspective.
Right. We would only notify those that had a need to know to protect the privacy of the employee.
Okay, great, thank you. A couple of remote teaching / work questions. Do we have a certain number or rate of infection that would cause us to either switch to remote teaching and work for certain employees at least? Well, I'll start with that one first.
Am I frozen? Sorry, I think I'm freezing up. I think I heard the last bit of the question. I don't know if anyone chimed in. The answer, Bill, is there. And I think we discussed this last year. There's no hard and fast number on what happens. But Annette, we have Scott, we have guidance from the state and local authorities. I think we take all that into account and we make decisions. Last year we pivoted multiple times in the fall semester, right? We pushed forward, we pulled back as needed, and that's going to be our plan this semester. As conditions warrant, we'll stay in the mode we're in. If we need to pull back, we'll also pull back. But there is no one set number, and these will be decisions that we'll discuss with the faculty advisory committee. If the cases begin to drive where it's out of control, if the crisis in our community on campus continues to grow, where we feel there's a threat, we'll pull back as we need to be. But it's going to take all of us working together, talking, communicating, and making sure we're doing what's best for our campus. So no, the answer is no. There is no one set number that's going to trigger it. It's going to be a combination of all of the data in our campus and the surrounding area.
Okay. Related question, and Tony, you and I had been talking about this, and Joanne Connor as well. Right now on this campus, we basically have two modes of operation. There's normal operations, and then with inclement weather, we shut the campus down. We've talked about the need for a third option. I think you were calling it the yellow option. Instead of red or green, it's yellow, in which case at least some of our campuses would be open, but faculty and some employees would be given the option of teaching or working remotely. Any idea when that policy might be available?
Yeah, we're working, I know Joe Cardona's not on the panel, but he's in here. Joe and the team, the emergency management team, we've been working on it. It's very close. We actually plan to discuss this with you and present it to you next week on where we are. So I think in the next week to 10 days, we should have it done. I feel pretty good. Look, this is, you know, open, closed doesn't fit today's needs, right?
No,
It
doesn't.
doesn't fit today's needs with the breadth of where people live, where people commute to, the ability to do things remote. And you know, I'm not going to say yellow because Joe Cardona doesn't like my yellow plan, but he likes the plan. He just doesn't like the tags with it. So let's not say yellow because he's watching.
Okay. I'll drop.
But honestly, I think there's going to be multiple modes. I think we're going to have I hope to see we have a remote optional. We have a fully remote, and then we have the good old fashioned snow days that we're going to need to have. So I think we need to have multiple tools in our arsenal how to deal with different conditions.
Okay.
You know, that way we're not sitting there at 5 a.m. trying to pull the trigger and the day turns out to be completely sunny and we're completely closed. That was the old way of thinking.
Mhm.
Now we have different tools, and at 5 a.m. we can.
Okay, you froze up at the end, but I think we got where you were going. 2 questions on non-compliant students. First, at what point will students who are non-compliant, which means neither vaccinated nor receiving a medical or religious exemption, at what point will those students be dropped from their classes or removed from housing or any other consequences?
Yeah, we have a process where, so we had the first week of testing last week. Those students who were not compliant got a message from me saying you need to show up to this week's test. If they don't show up to this week's test, then there will be accountability where they'll be removed.
Okay, thank you.
If they then get back on track, then they're okay. But if they then continue, then they face suspension, not just removal from in-person classes or housing.
Okay, great. And also, will departments who have student workers be notified if those student workers are in compliance?
Yeah, that's a great question. What has been happening and what I recommend is if people have specific questions, just reach out to me and we can check them because I'm not sure exactly where all the student workers are and some of those positions are still being appointed. So if somebody's got student workers that they want to check, just have them email me and I will check for them.
Okay, great.
And
I
not
know
going through the HR process because we don't want to duplicate processes, and their student is the primary process for them.
Okay, thanks. I know we're getting near the end of the meeting and a number of people need to drop off. What steps are we taking to make sure that both students and employees are submitting valid proof of vaccination? And what are the consequences if they submit fraudulent proof? I mean, many of us heard of the person who claimed she had a Moderna vaccine and misspelled it on her fake vaccine card. And it turns out she was a nurse of all things. So what are the consequences for both students and employees who would submit fraudulent paperwork?
Yeah, I heard about that they spelled it MAD, Moderna. So I think Tony had mentioned this. One of the, the reasons why automating this process is not easy is not only do we expect the students and the staff to submit the dates, but also a valid record. So we put eyes on those records. If those records in any way look like they're not legible, illegitimate, or not legitimate, we individually pull up their account in NJIS and reference that. So we're doing our best. So state guidance requires any immunization record to be on an approved format, which is either assigned from a physician's office, an account from NJIS that's printed and handed in, or now the cards. But if any way the card, we can't make something out, there's something handwritten on it, doesn't make sense, that gets referenced to NJIS. We make sure those dates are legitimate in the system. Now, of course, everyone's heard about the case in New York where someone was selling, they were selling, people were paying to have them uploaded into the system. I haven't heard of that happening in New Jersey. I mean, our system seems pretty good. Like I said before, there's nothing that's 100%. But I'm pretty confident that we're validating, which again is one of the reasons we're also reading the exemptions and making sure that they meet the standards that are required. So all that takes time. That's why this process was so difficult, probably more difficult than we anticipated, as you mentioned in your intro, because it's true. I mean, it's absolutely true. I wish that weren't the case. But anyway, so yeah, again, another long-winded answer, sorry. But yes, that's what we're doing. And there will be serious consequences, especially since we gave incentives for that. So now you're talking about those dollars So potentially that could be a federal issue in terms of a crime there. So I'm not a law expert, but I believe there'll be significant consequences for fraudulence.
Yeah, actually, in reality, because there is a CDC logo, which is a federal logo, it is considered a federal offense to present a fake card. So from an employee perspective, it would be viewed similar to how we would manage anyone else being accused of fraud.
Okay, so very serious offense then. Thank you.
Bill, I also think that if somebody is a healthcare professional, a licensed healthcare professional, and they do something like that, that could lead to loss of their license. Nurses,
Wow. Okay.
physicians, pharmacists, loss of license.
Okay, so yes, very, very serious. We got to almost all the questions, but not all of them. We will be answering the other questions that were not addressed here. I'd like to thank all of the panelists for attending today. Very, very helpful. Obviously, there's still a lot of uncertainty. Feel free to reach out if you have other questions which were not raised today. And this has been recorded. It will be posted, so people who are unable to attend will be able to view it at their convenience. So thank you, everyone. Appreciate it.
Bill, can I just add one thing? I want to add one last message. Again,
Sure.
This is a chaotic time. There's a lot of going on, a lot of moving parts, and a lot of things we're trying to do. And for people who don't know, Bill and the rest of the Senate leadership team, as well as Joe and the rest of the AFT leadership team, we're in constant contact. We're constantly talking. We're constantly fixing the issues. So I encourage you, not because we don't want to hear individual voices, but it allows us to be much more efficient, deal with all these issues, and more importantly, hear all your concerns if they're directed through these two and these groups. So please work through them. It gets to us. We listen, we respond, and we'll get back to you. So I thank all of our to all our faculty and staff. Thank you for all of the work coming back the last 2 weeks. I know it hasn't been easy, but we're going to get through this. Good times are ahead for us. So thank you today.